I'm Joanna and I will do your makeup today.
Hi Joanna, thank you so much.
Hi. I will do your eyebrows now. Now I'm gonna correct your eyebrows. Look up. Look up. Up. Open your eyes and look forward.
Okay.
Look at me. Close your eyes. Look at me. Look forward. Look at me. Do you want glitter?
Maybe just a little bit.
Okay. Close your eyes. Look at me. Look at me. Close. Look at me. Close. Look at me. So, do you want glitter?
Just a little bit, maybe.
Okay. Close your eyes. Look. Like this.
Yeah, perfect.
Look at me. Look at me. Close. Close. Look at me. So no glitter.
Yeah, maybe not. We'll skip
Okay.
the glitter for next time.
Okay. Do you want eyelashes?
No.
Just mascara?
Yeah.
Okay. Look at me. Close. Close. Look at me. Close. Close. Look at me. Close. Look at me.
Beautiful.
Close. Close. Look at me. Close. Look at me. Close. Look forward. Look forward. Close. Look at me. with me. I will apply the mascara. Look down, down. Now I'm gonna apply moisturizer.
It's cold.
Up. Look up. I'm gonna put Vaseline on your lips. Now I'm gonna apply your foundation. I'm gonna do your contour now. I'm gonna apply the concealer now. Now I'm gonna blend it. Look up. Now I'm gonna apply your blush.
That's it?
Yeah. What do you think?
Perfect. I really like it.
I'm glad.
Thank you so much, Joanna.
You're
And
welcome.
I hope I will see you again.
Yeah, I hope that too.
Okay, bye-bye.
Bye.
Hi Andrea,
Hi.
thank you so much for coming in today.
Thank you.
How do you feel?
Fine.
So today we are gonna do some core therapy. Did you had this before?
No.
So it's your first time,
Yes.
right? Okay, so I will explain just a little bit what core therapy means.
Okay.
So I will start with some kinesiology, that is a muscle testing. So basically it will tell me how your body is or where we have to work on it. Okay,
Okay.
so then let's start. Okay,
Okay.
so raise this arm please. Just don't let me push. And hold. Good. Let's try with this one. And hold. Okay. And let's see this leg. Hold. Okay, you can relax. And we do this leg with this arm. And hold. Good. Let's see now this leg. And hold. Good. And let's see this and this arm. Hold. Okay, good. So this arm was a little bit weaker. So we're gonna see why, okay?
Okay.
We're gonna do further testing. So I will work on your back because sometimes it will tell me if this arm was weaker. Okay, relax now and raise the arm again and hold. It's a little bit better. Okay, so I'm going to check your posture, your shoulders now. Maybe we have to work on this one to check your ribs, pelvis here. They look aligned. Let's see the knees. Knees are good. Okay, Andrea, so give me this hand now with this leg. And hold. Good. Quite strong. And this one with this arm. Both are very strong. So can you use this arm and put the 2 fingers on your TMJ on this side? Perfect. And lift this hand, arm, and hold. It's a little bit weaker. Raise this arm and this leg and hold. Okay. And now can you do this one on the other side and raise this arm and hold. Good. And let's see this with this and hold. Perfect. Okay, and put these 2 fingers on this side now, and I'm gonna check this arm. Hold. Very strong. And keep it there, and I'm gonna check this arm with this feet and hold. They're not so strong. And put this. Okay, perfect. And hold. This is strong. And now hold. Perfect. So it's a little bit weaker on the other side. And I'm gonna work a little bit on your face, on the TMJ, to release the tension, okay?
Okay.
So I'm going to feel your TMJ on both sides. Just trying to release the pressure. Feel the energy. On the left side it's better. Just have to work a little bit on the right side. Are you right?
Yes.
Just take it out, take it out. I think it's better now. Okay, perfect. So we're gonna retest now, okay?
Okay.
Okay, Andrea, so we're gonna retest now the muscles. So this arm with this and hold, perfect, very strong. And let me check this one with this and hold. Still this one it's a little bit weaker, the right side. Okay, just do the arms to see. Hold. Good. Let's see this one. Okay. Not so brilliant, but okay. And let's see if the knees are coming up. Make sure they are not twisted. Let's check the arm again. And hold. Good. Let's check with this. Good. And let's check one more time. This one. And hold. That one was a little bit weaker, right?
Yes.
So raise this arm and this one, put it just a little bit on the side like this. Okay. And hold. Okay. Move it like this. Okay. And hold. And just put it all. Okay, perfect. A little bit weaker. And now stay like this with the palm. No, with the palm like this,
okay.
and then we're gonna switch, okay?
Okay.
So stay like this and hold. Okay, and turn it. Perfect. And hold. This is better. Okay, you can relax now. Good. So Andrea, I did some testing, and tell me, how is your digestion?
It's okay.
It is good.
Yes.
Do you
but
have any pain,
yes.
cramping?
Sometimes I feel pain in right here.
On the
Right
side.
side, yes.
Okay.
And sometimes cramping, yes.
It is okay if I check the
Sure.
this side?
Yes.
Okay. Can I just lower the pants a little bit?
Yes.
Okay. So I just want to check your ICV. Did you ever check that or no?
No.
So the ICV, it should be in the middle between the hip bone and the navel. So in the middle, it should be around here. And the ICV is located between the small intestine and the large intestine. So the function is to periodically let the food in to digest. So I'm gonna check it out, and then also you can do it every time in the shower. And if you have some pain all the time you can massage like this, so from the navel to the hip bone on this side to relieve the tension. Okay, so this is a little bit like intrusive. I'm gonna put my 2 fingers. Any pain if I'm pressing?
No.
What about now?
Yes.
Okay, I do feel it's a little bit tender. Good. So now I need you to take 3 deep breaths in and out. Okay? Good. Okay, so start with the first. One more. Good. So I'm just gonna work a little bit. And you can do the massage all the time like this, not on the opposite direction. How do you feel it now?
Okay.
Feel it okay?
Yes.
So you can do this in the shower every day, and this will help the digestion. Okay, now put 2 fingers here and raise this arm and hold quite strong. How do you feel it? Just push down a little bit.
It's okay. It's good.
It's good?
Yes.
Okay. Yeah, I don't feel it tender anymore. Good. So we checked this. So you can turn over now, okay?
Okay.
So now I'm gonna do some tuina, and I'm gonna see how your muscles in the back and on your lower back are, okay?
Okay.
And let me know if you have any pain or tenderness. Checking your shoulders. This side it's good. to feel it here a little bit. Do you have any pain when I'm doing this?
Yes, no.
I'm gonna do on the other side as well.
Okay.
Okay. So on this side it's a little bit tender. Okay, so just give me this hand. Just relax. Okay. Okay. And relax. So I'm gonna work a little bit on your back here in the middle because you feel it tender. Good. Just slowly, slowly. And I'm gonna go down again on your lower back. And then I'm gonna stay in the middle. I'm gonna push. Do you have any pain
In right side.
on the right side? I think it's better now. Okay. How do you feel now?
I feel okay, better.
Okay, so let's work on your legs now. I'm gonna press So good. And let's see. Just keep it low. Wanna see how your leg is moving. Si vede? Okay. I'm gonna press on this one. Good. And I'm gonna see how is this moving. Okay. And I'm gonna take both. Good. So let's take your both legs. Perfect. Okay. Let's see. How is this one? Make sure it's not twisted. Ooh, it's a click. Good. And one more time. No more clicking. Oh, one more. Let's see the elbow. Okay, and I'm going to check the other one. Okay. No clicks or just one maybe. Okay, let's see. Perfect. Then I'm gonna do some Trina as well. Okay, and I'm going to work on your neck a little bit to relieve some tension. This arm was a little bit weaker from the beginning,
Okay,
right?
yes.
So, okay.
lift your head again and just relax. Just relax. Gonna work on your shoulders as well. Just going to work on the left side as well a little bit. Now, just want to release the tension and feel the energy. Just let it go. Let it go.
So let's do some retesting like I said, okay?
Okay.
This arm, hold, perfect. Hold, very good. Hold, perfect. And just turn it around, good. And one more time. Hold, very strong. So how do you feel?
Better.
Better?
Much better, yes.
Okay. So I'm so happy that everything is fine and we did this kind of testing today.
Thank you.
I hope you enjoyed it and you will come back next time for another session.
Sure.
Thank
Thank
you
you so much.
Thank
Bye.
you. Bye-bye. Hi, Amber.
Hi.
How are you?
Good. How are you?
So I saw in your chart that you're here because you had some skin problems, some moles on your body.
Yeah, so I've actually never checked them before. I have quite a few moles, and I noticed some of them are more elevated. So, I've been reading a lot about this, and I wanted to make sure everything is fine. I'm especially concerned, during summertime. Sometimes I apply SPF, but sometimes I forget, and I definitely like being outdoor a lot during the summer, and I get very tan. My skin is darker, and I want to make sure everything is safe and I don't have any problems with my moles and no concerns.
Okay, so definitely I will check all the moles on your body. I'm gonna be your skin specialist and I will do my best to make sure everything is fine and to see if they are elevated, they are changing in color, or if you need further testing, okay?
Sounds great.
Do you have anybody in your family that have skin problems?
Not that I can think of, but my mom is definitely a lighter color and she doesn't have as many moles that I have. So I think my skin is different and it's definitely reacting differently.
Yeah, any scalp problems?
It's pretty dry, so my scalp is pretty dry and I do have downruff. I try to use shampoo especially for that, but I don't know if it's really working.
So definitely I will check your scalp as well, and then I also see on your neck area you have a few. So yeah, so let's
I
begin.
have them everywhere.
Okay, let's begin the exam and we'll go from there, okay? So I think you can lay down with your head this way and I will start with the scalp, okay?
Sounds great.
Okay, Amber, so I'm going to put my gloves on and start to check your face first. So I see you have a few on your cheeks.
to here. On your neck. So I see one on your neck here. It's a little bit elevated.
Okay.
Did you notice if they changed the color or they are bigger than before?
I don't think so. It's hard to tell because some of them I can't really see them, like on my back or even my neck. I feel it, but I only see it in the mirror. This one sometimes I can, when I zip my clothes or like with jewelry, I tend to bother it. So I think it's more concern.
So let's see your shoulder. I see you have a few, but they look fine. On this side as well. Okay, so I'm going to start to check your scalp now. I'm going to use this pink comb. So I do see the dandruff that you were talking about, but I don't see any redness, and you don't have any moles so far. Your hair is extremely thick. You can stay like this, maybe.
Sure. I have a lot of hair.
Yeah, so definitely you need to, I see here, for example, it's very, very dry. So I think you should use specialized shampoo. So right here, it's very, very dry. How often do you wash your hair, Amber?
Once a week.
Once a week?
Yes.
So I will encourage you to wash at least 2 or 3 times per week and use a very good shampoo.
Sometimes, it's time consuming because I have so much hair, so, in order to wash it and dry it, especially in the winter, I don't want to go out with my hair wet, so it takes me a long time, to wash my hair, and I know that, well, if you wash it too often, then it's gonna get more oily faster. Your hair tends to kind of learn the process and then it gets oily way faster, and I don't like having my hair oily.
Yeah, but I think you have excessive
Sebum.
no, it's extremely dry and dandruff and might be dermatitis as well.
Okay, I'll try that.
You can just
It might be from the dye too, because my hair is not natural, so it's, when I go to the salon, they apply all kind of chemicals that are probably very harmful for my scalp.
And also your skin is a little bit dry on your face. Are you applying any cream?
Yeah, actually I do in the morning and at nighttime. But during winter time it gets pretty dry.
So I'm going to check this side as well. So if you want, I can give you I can tell what shampoo I'm using now, and I think it might help you.
Okay, sounds good.
So look here. So you have a lot of skin issues. I didn't see any moles, but now you really have to work on this and to fix this problem. Yeah, so definitely you have to work on your scalp. And maybe you might consider in the future not to dye your hair anymore. I know it's not so healthy until you resolve your problems. So I'm going to check your belly now for the moles, and then I will check your back, okay?
Okay, perfect.
Is it okay if I lift the shirt?
Sure.
And can I lower the pants as well?
Sure.
Okay, it's a little bit tight. So you have a nice tattoo. This is an angel, right?
Mm-hmm. Yes.
So I see one here. It's a little bit bigger. I also see a mark in the middle.
I fell off my grandparents' house when I was tiny. Well, not that tiny, but
You have one here, two more. Okay, this one is a little bit elevated. Does it hurt?
no, not at all.
So it's still brown. It's a little bit lighter on the edges and it's darker inside, but it looks good. I don't see it concerning. And you have a lot that are very, very small. Any pain around your belly?
No.
No? Okay. So would you mind if you turn on your belly so I can check your back as well?
Sure.
Thank you. Okay, Amber, so checking your back. You do have a few. I see your skin is darker. You have another one that's bigger here. And you have on the other side as well. So another one that's big on the right side. Okay. Great. So I didn't see any moles that it's concerning. Okay, so I'm checking your legs right now. I see you have a darker color, so I really like it.
Thank you.
So let's see. You have a few on your upper legs, but they look okay. I don't see them elevated. And they are brown like normal. You also have a few small. Okay, let's see on your lower legs. You don't have so many like on your back or on your belly. I see you have another ones here. Another one. Okay, and pretty much that's it, right? also going to touch your legs to make sure I'm not missing anything. Okay. Can you turn around, please?
Sure.
Okay. So your skin is in a very good shape. I see your feet are very dry. Okay, let's see what's here. It's like a mark. You have another mole there, but it's good. Okay. And you have some, let's say, deformities.
Yeah, it's from the bunions.
From the
I
bunions.
should probably get a surgery, but I'm afraid of the recovery process, so I'm kind of postponing it as much as I can.
So if I touch this, it's it's hard and it's very dry. So you have it, you have one here, you have another one here, and you have one on your big toe, and also your calf is very dry. Maybe you should use a lotion or whatever you want more.
Yeah, my skin is dry. My extremities, especially in the winter time, it gets really dry. I think I should probably drink more water.
So if I'm checking the right foot, it's the same. So you have one here, another one in the middle, and on the side I think are the most hardest part. Does it bother you when you walk?
No, not at all.
No?
No. Just the bunions sometimes if my shoes are tighter or, the material is not flexible. If I walk for a long period of time, then at the end of the day I would feel it. But it's not terrible. I mean, it's pretty manageable. So
Did you see a specialist for this?
I've seen a specialist, and he did explain to me, what's been happening, how my foot got deformed. It's probably from tight shoes when I was little. So the shoes were not the right shape and the right size or stuff like that. And then the bone kind of got a different position from the toe, and then all of the other bones are aligned differently because of that. But he did explain, that my only option is surgery, and the recovery process is pretty hard. So right now it doesn't bother me as much as to go through the process. But if at some point it's gonna interfere with my my mobility or my quality of life, then I'll take care of that.
Okay. So I will check your arms. So you can stand up, and then we're gonna discuss the results of this session, okay?
Okay.
Okay, Amber, so can you extend the arms in the front? Just wanna check. Everything is okay. Okay, you can relax and try to turn it a little bit. Okay. So let's see this one here. And let's check the other. You do have a few moles, but they are not elevated, they are not red. So actually, this one is bigger. Does it bother you?
Feel a little bit when you touch it.
Okay, so just make sure you monitor this. You check it all the time to make sure it's not growing. Does it bother you when I do this?
No.
No? Good, so I will also measure and write it down in the chart to see in a year if it did grow or not, okay?
Sounds good.
Good. Perfect. So you do have a few moles, but if you check them all the time, if you wear sunscreen on the summer, I think they should be okay.
Oh, that's great news.
Any questions?
Yeah. Do you recommend any specific sunscreen? Any level of sunscreen, like 30, 50?
I will suggest the 50
And
if you can
how
in the
often
summer.
should I apply it?
So every day, if you go out
Every
every day,
2
like
hours.
it's every day. So it depends how long you stay in the sun. So if you stay in the sun, you apply it more often. If not, not so often, but every day you should use it.
Okay, well, I'll try.
And yeah, for your feet, just try to at least use some lotion or so. You said you've been going to a specialist for what you have, right?
Yes.
Okay. So then, if everything is fine, then I will see you in 1 year. Okay?
Okay, great.
Thank you so much. Take care.
Thank you for having me.
Bye
You
bye.
too.
Hi, Patricia.
Hi.
How are you doing today?
So not really good because I feel some pain around my shoulders, which also affects the back of my neck, and I do feel the need to always crack my neck, and also a bit of pain on my mid back here,
Okay, I'm sorry about that. And do you have these symptoms for a long time?
like a week or so.
A week. Were you involved in any car accidents or any other type of
No,
injuries?
but I don't sleep very well.
Okay. Do you have any headaches?
A bit, yes, since yesterday I think.
Are you taking any medications?
No,
Are you allergic to anything?
no.
And the pain is on both shoulders.
Both of my shoulders, yes.
And does it affect the movements, or do you have any problems with the range of
Yeah.
motion?
Yes, it's hard for me to move.
It's hard to move. Okay. So the shoulder problem is a common problem, and I will try my best to see what's going on. And first I will do a cranial nerve test, and then you can lay down and I will inspect your neck and shoulders, okay?
Okay, thank
Good.
you.
Okay, so I'm going to check your face for asymmetry. Any pain on your face?
No,
Any numbness on one of the sides of the
No.
cheeks? No?
no,
Any headaches? Any pain if I do this? Sorry.
no,
No? No?
no.
And do you know where the headaches are?
Yes, in the back of my head, right
So
here.
it's in the back.
Yeah.
Okay, so if you have neck problems, if you have pain on the neck, and it's probably going a little bit up, so
I
that's why
think
you
so,
have
yes.
the pain. Okay, so let me do a quick test. You can close your eyes.
Okay.
Okay, good. And can you extend now to see how much can you extend
Like this.
like this only?
Yes, because it hurts here.
when I'm pushing.
Yeah, it hurts.
And what about this one?
Like this.
And did you ever try to put your arms in the back? Can you do that?
I guess.
Hmm?
It hurts.
So it hurts around your... Okay. So I will do reflexes testing. So just relax. So just stay like this. Okay. And I will do with the other one. Okay, good. Okay, Patricia, so I also want to check your eyes. I'm gonna come very close to your eyes. Is that okay?
Okay, yeah.
So I'm gonna check the pupils below for any anemia or jaundice. I'm gonna check up. Good. Perfect. Good. And just keep your head straight like this. Open your eyes. Just look at me. I'm gonna check your pupils. They are round and reactive to light. And now just follow the pen light, please. Good. Any problems with your ears?
No.
So I'm just gonna do hearing test, okay? Do you hear this buzz?
Yes.
And tell me when it stops.
Now.
Do you hear it now?
Yes.
Tell me when it stops.
Now.
And tell me which one is louder. Position number 1, position number 2.
1.
Good. Number 1, number 2.
1.
Good. And did you notice any changes in your taste or smell?
No.
No?
No.
So I have a few bottles if you can identify the smell, okay?
Okay.
Can you cover one of the nostrils?
Sure.
Breathe to the other one to see if you have any congestion. I do hear a little bit of congestion. Can you check the other one? I think this is better a little bit.
Yeah. Vanilla.
Yes. This one?
Apple.
Yeah.
Lavender.
Yes.
Ocean.
Yeah. Actually, it is ocean. It's perfect. Any problems with your breathing, with your heartbeat? Do you have any irregular heartbeat?
No,
Do
I
you
think
feel
it's
good?
fine. Yeah.
Because I know last time you did have some problems with the anemia and
This time I feel better.
you feel better?
Yeah.
So it's okay if I listen to your heart and then we go to check the neck, shoulders and your back?
Yeah, it's fine.
Okay. So breathe normally now. Okay, Perfect. So then you can lay down.
Okay.
So I'm going to inspect the neck and shoulders area. Do you have any pain?
A bit, yes.
Okay, let's see around in the back of your neck. I do feel some tightness here, so I will work on your neck to release the tension. Good, so I'm going to apply a little bit of oil so it will be easier. So I'm gonna do some stretching as well of your neck. So just try to relax. And let me know if you have a lot of pain. I also feel some tension right here.
Yeah.
So I'm gonna do more massages when you turn on your belly. Okay. So just I will hold your head. Okay. So I'm gonna do a little bit of cupping here. How does this feel?
Good, but I do also feel pain here.
Yeah, I think this is normal, but it will release the tension. Okay, so you can return your head this way, and I will work on this side. Okay, and I'm gonna use this for your neck. You can keep your head straight now. I'm gonna come very close to you. Just gonna massage the sides, the back of your neck, and then you can turn on your belly. I'm gonna do a few more stretches. I'm gonna push a little bit. Perfect. So you can turn over, okay?
Okay.
Okay, Patricia, so I did some stretching and massage here in the back of your neck, and I will use some acupressure points in your head, so for any potential headaches.
Okay.
Do you like this?
Yes.
Okay, we'll get see with this ones. Just going to gently use my fingers a little bit so you can detension, and then I will start checking your back. Perfect. So I'm checking your back right now. So your pain, you said it's mid,
Yeah.
and it's going to your lower back as well, or it stays here?
On my lower back as well.
So it's going down. So I did check your skin. I didn't see any abnormalities. You just have a big mole here, but I didn't see any redness and any bumps. Your back is even, so I'm going to feel your spine now. So right here I do feel a little bit of tension. Do you have pain more on the right or on the left?
On the left.
Yeah, right here. It's a slight inflammation on the left, but I will also measure your back. Any pain here?
No.
Here?
Yes.
So a little bit on your hip.
Yeah.
Okay. Good. So I'm going to measure your spine. Okay, Patricia, so I'm going to work a little bit on your spine. With the back of my hands, and I'm going slowly down. Coming up. Any pain?
Yes, tenderness
Yeah.
mostly.
So it's mostly right here, right?
Yes.
Going up. And going down again in the middle. So I will try to do some movements a little bit. Try to pull. So I'm going to apply some acupressure point. And then I will do a gentle massage. Okay, I will use the roller in the middle of the spine. Just feeling every vertebra. Are you ticklish or do you feel
Yes.
any pain?
I'm very
Ticklish. I will use it in the middle. Sorry about this. Okay, Patricia, so I'm gonna do some adjustments. Okay, perfect. Do you feel comfortable?
Yes, very.
Do some stretching. So just a little bit to work on this side so we can release the tension. How do you feel this?
Good.
Will use it on this side as well. Going on your shoulders a little bit, the scapula area. Good. Just want to work a little bit on your lower back where you have the pain. So I think next time when you come we can do some muscle testing
Okay.
to see which part is weaker and which one we have to treat. It's definitely better here.
Yeah, yes.
It's a little bit better. So this is it for today. So next time then we're gonna do the muscle testing and yeah, we'll see how you feel next week, okay?
Thank Thank you so much. I feel a lot better.
Thank you so much for coming and see you next time.
See you.